Thank you for joining us at AskTheseDoctors.com. In this video, we'll give you quick medical facts which could potentially save a significant amount of money at your next healthcare visit. This video will deal with the issue of bladder infection or UTI. Urinary tract infections and bladder infections are synonymous. Symptoms possibly could include burning with urination or painful urination, a strong or foul smell to the urine, cloudy or even possibly some blood in the urine or pink-tinged urine. Vaginal symptoms such as discharge, itching, burning, or any vaginal sores suggest a completely different problem. Kidney infections are a severe form of UTIs. Fevers are possible. A patient may experience back, flank, or even kidney area pain. Nauseousness and vomiting are possible. Abdominal pain or discomfort also can go along with kidney infections. If a patient is pregnant and has any of these symptoms, they need to be seen immediately. If you have any of these above symptoms, you also need to see your doctor as soon as possible. Testing. Urine analysis, which is a microscopic test or chemical test or both, $21. Urine culture, $45. That's where the lab grows the urine for a few days to see what type of bacteria show up. Then they'll test that bacteria against a variety of antibiotics to see which ones will kill the bacteria. A urine pregnancy test, $29. A blood pregnancy test is $47. There's really not much necessity in having a blood pregnancy test. The urine test is sufficient. Who needs testing? Perhaps some patients have had so many bladder infections, they're in tune with their body, they know the symptoms, they know when they're getting one. They may be able to persuade their doctor to treat them over the phone. That would save a clinic visit and a lab test. Right there, a potential savings of $100 to $200 depending on the clinic. There are options. Urgent care centers or walk-in clinics are probably the best option if you need to be seen. The cost will be lower than the emergency room. If you end up in the emergency room because of a bladder infection, usually the insurance copay is much higher, $50, $75, or $100. The physician charge, lab charge, everything is just plain more expensive in the emergency room. Options include phoning your doctor, the nurse helpline. Perhaps your insurance company has an 800 number that you can contact. Some patients want to know if it's safe to wait. Well, if there's fever, abdominal pain, vomiting, severe back pain, that person needs to go in immediately and be seen by a healthcare professional. If a person has maybe just a little bit of burning with urination, it might be okay to wait. There are some things that can be taken over the counter that can help alleviate symptoms, and we'll cover that in the next slide. That may save you a trip to the ER in the middle of the night or over the weekend. There are many choices of antibiotic treatment. The choice depends on the patient's history, drug allergies, or perhaps if pregnant. We'll give you the knowledge of some specific antibiotic options. That alone could potentially save a significant amount of dollars. As you can see from the slide, the top listing of antibiotics can be got at most pharmacies for $4. As you move down the list, you can see that the price jumps up significantly. Levaquin, great antibiotic, brand name, $95.32. What would you rather pay, $95.32 or $4 for the same result? If you need a shot of antibiotic, be aware that the clinic charges a shot administration fee. The charge for the nurse just to give the shot may range anywhere from $35 up to $50. Add on top of that the cost of the antibiotic, which could be up to $100 or more. You can see the price of that visit went up significantly. Cipro and Levaquin are the same family of medicine. They're both absorbed very well orally by mouth. In that setting, you may be able to talk to your doctor about trying that route as opposed to the injection route. Please discuss this further with your doctor. This may save you potentially a significant amount of dollars. Over the counter, there are several options that can treat the symptoms. Azo, Urostat, and many others are few of the over-the-counter medications you can purchase. Be sure to ask your pharmacist, read the label, or ask your pharmacist if there's any interactions with the medications you're taking or any of your allergies. Pyridium is a prescribed medicine doctors often give along with antibiotics for bladder infections. This helps relieve symptoms immediately while the antibiotic starts to work. This works by a similar method as the above over-the-counter medications. All of these drugs can have the potential to discolor the urine, so don't be alarmed if your urine appears orange or has a reddish hue to it. As you can see from the short video, we've given you a few antibiotic choices, and you need to discuss those further with your doctor. That could save you potentially a significant amount of money. The previous slides show how some simple knowledge translates into cost savings for you, the patient. This is a complete video. The sample video was shown on our home web page. Please see our other topics and be prepared to save even more. Thank you from the team at AskTheseDoctors.com.